I consent to this video.
Here's my badge. Alright, so first things first, I'm going to enter the patient's room. I'm going to have my hands washed and I'm going to have the proper materials for the procedure. Today that would only be gloves, which I do not have on me. So I will introduce myself to my patient. Say, hi, my name is Corey Kaufman. I will be your student nurse today. And I want to identify my patient as well. So what's your name?
Austin Meyer,
And your date of birth.
7/17/1998.
Perfect. So now I'm going to explain the procedure to Austin. I'm going to say, Austin, today I'm going to do an assessment of your upper extremities, your lower extremities, and your heart sounds. At this time, I would provide my patient with privacy if need be. And I also want to make sure that I ask Austin any pertinent medical conditions he might have that have to do with our assessment here today. So Austin, do you have a history of any heart murmurs?
I do not.
And do you have a history of heart attacks?
No.
Perfect. So now we can go ahead and I provided my patient with privacy and we can go ahead and move on to the heart sounds portion of the assessment. So I will ask my patient to please stand up and remove your shirt. Alright, so we're going to go ahead and assess 5 heart sounds today. We're going to first locate all of them. So the first heart sound that we're going to locate is the aortic heart area. So that will be on the right sternal border, on the right, the right sternal border, and the second intercostal space. So I'm going to start at the clavicle and locate the first intercostal space and go down to the second. And the next one I'm going to find is the pulmonic heart area, which is the same, just on the left sternal border. So also the second intercostal space. All right, the third is going to be Erb's point, which is on the left sternal border at the third intercostal space. All right, the fourth is going to be the tricuspid area, and that will be also on the left sternal border, and it will be the fourth intercostal space. And finally, the fifth will be the mitral heart sound area, and that will be on the mid-clavicular line on the fifth intercostal space, also here on the left side. So we'll go to the mid-clavicular. So now that I have all the heart sounds located and identified, I'm going to go ahead and give them a listen. Things I want to know is good S1 and S2 heart sounds, which are normal findings. And when I'm listening at Erb's point, I want to notice any murmuring that I may hear. All right, also, I'm just going to take a listen. Erb's point. I don't detect any murmurs, so we'll move on. And finally the mitral at the mid-clavicular line. Alright, perfect. So the things I want to note and document is I heard good S1 and S2 sounds on both sides of the chest. I heard S1 louder at the apex of the heart and S2 at the base of the heart, which is expected. The other thing is I did not detect any murmurs at Erb's point. So at this time, we can go ahead and move on to the upper extremity assessment. So Austin, if you want to go ahead and lay down on the bed. First thing I'm going to do is I'm going to take a look and say that both arms appear to be similar to equal in length and size. I do note some redness in the form of what seems to be some sunburn, but I don't notice any edema or redness. Other than that, that would be a cause of concern. I do notice some primary lesions around the bicep area along the arm on both sides, and they're in the form of moles. That is a primary lesion. They are pinpoint in size, they are circular, and they are scattered and patterned. So nothing for too big of a cause of concern. The next thing I want to do is go ahead and I want to do the grasp test. So I'm going to test the strength on both sides of the arms. So Austin, I'm going to have you put my hands in yours and go ahead and squeeze. Alright, both sides are bilateral in strength and they are both strong, so there's no cause of concern there. The next thing I'm going to do is then I'm going to go ahead and move on to the lower extremity assessment. So Austin, if I could please remove your shoes and any socks you may have on. Alright, and I'm going to make sure I have full visibility of the legs. So the first thing I'm going to do is, oh, and one thing for the arms I forgot to say was the color. I'd like to note that he is tan and it is even distribution of color. So then on the legs, I'll start there as well. I will note that they are also tan, similar in shade to the arms. I'm going to go ahead and lift your legs, Austin, and give them a look. And feet and toes. Alright, so I don't notice any abnormal redness or edema upon inspection. I do notice, once again, I have a lesion here. It is in the form of a mole. It is a primary lesion on Austin's left kneecap area. It is about pinpoint in size, it is circular, and the distribution is scattered. So there's no cause for concern there. The next thing I want to do is go ahead and I want to palpate Austin's legs to check for any edema or swelling. So Austin, I'm going to take my hands along the length of your legs and feet, and I'm going to palpate them, just checking for any swelling or fluid buildup. First leg is good. And the second leg also appears to be good. I don't have any signs of edema or swelling on either side. So the next thing I'm going to do is I'm going to test the temperature of the legs using the back of my hand. If I had gloves on, I would just lift up the back of my gloves. And I'm going to make sure that I go the entire length of the legs all the way to the toes. Alright, so the temperature is warm and equal on both sides. The temperature does get cooler as I move down the extremity to the toes, which is an expected and normal finding. Another thing I want to notice about the legs when I look at them is I want to notice the hair distribution on the legs. It is even and full on both legs. It is not scattered or splotchy in any way. And I also want to look for any venous patterning. And I do not know any on either the anterior or the posterior side of either leg. So now the next thing we can do is go ahead and move on to flexion. So Austin, I'm going to first test your dorsal flexion. So I'm going to put my hands on this side of your feet and have you pull your feet back towards you. Alright, both sides seem to be strong and equal in strength, so there's no cause of concern there. Next, I will do plantar flexion. So I'm going to do the opposite. I'm going to put my hands on this side of your feet and have you push against me. Alright, and once again, both are equal and strong on both sides. So now I'm going to go ahead and move on to assessing rhythm of pulse in the lower extremity. So I'm going to first do the anterior tibial pulse, which is located on the inside of both legs, right next to the ankle bone. And on both sides, they are strong, they don't feel distant, and it is regular rhythm, so I would grade both of them a 2+. Next, I'm going to move on into the Dorsalis Pedis rhythm, So that is located in between the first two toes on both sides of the feet. And once again, I don't notice any bounding. The rhythm is very regular and strong on both sides. So I would once again rate it a 2+. So the last things I'm going to do is I'm going to inspect the legs once again just to make sure I didn't miss any ulcerations or lesions of any kind, and make sure that the legs are in overall good condition, which thus far they appear to be. And I'm going to make sure to check the feet, top and bottom, in between toes. And I do not note any ulcerations. The last thing I want to ask Austin, is Austin, in any of your extremities, are you experiencing numbness or tingling? All right, that's good. So that will conclude our assessment. So now I want to make sure Austin's bed is in the lowest position. I want to make sure his personal items are within reach, his call light is within reach, and the side rails are raised ×2, and I would document